Hello, everyone. Welcome to this webinar on gathering community data. This is one of our LCRC, or Learning Communities Resource Center, knowledge building webinars within our national webinar series. We do these webinars oftentimes on Wednesdays at 2 p.m. Eastern Time. So we're glad that you chose to join us this Wednesday. And this particular webinar is actually a part of 3 of our different open learning community groups. The results at the community level, cultivating data-centered organizations, as well as health intersections. And so we're glad that you all could join us today and learn about gathering community data on the social determinants of health and poverty. We have a couple presenters with us today, and I'll do proper introductions later, but we do have both represented from Community Commons as well as County Health Rankings and Roadmaps that are going to be sharing some of their online tools and information with you later in this webinar. But as we get started, we always like to begin with the promise of community action because it really grounds us in the work that we do. So you can join me as I recite this. Community action changes people's lives, embodies the spirit of hope, improves communities, and makes America a better place to live. We care about the entire community, and we are dedicated to helping people help themselves and each other. So our agenda for today, first we're going to go through a little bit of learning community information, then I'll give some introductions to who we have on the line today to share some good information with you. Then we're going to be talking about kind of just the overall purpose of gathering community data. We'll have our presentations from our guest speakers today, and then we'll do a question and answer session. We actually will be taking a couple different breaks for question and answers throughout the webinar today. And so what you'll do is, as you're going through the webinar, please use the chat function. There's a little thought bubble above the area where it says participants in your WebEx platform. And so that's the function that would be best to use to send in your questions. And feel free to send those in at any time throughout the webinar. We'll kind of keep track as they come in. And then once the opportunities come up to ask questions of the facilitators, we'll pause and we'll facilitate those questions to them. Because there's right now about 76 people on the line, we are going to keep everyone muted throughout the duration of the webinar, just to cut down on background noise and such. So that's the best way to communicate, is through that chat function. You can also use the Q&A function at the very bottom as well. Another note, as far as housekeeping items, if you do have trouble with any audio, we have one of our team members, Hyacinth McKinley, on the line, and she can help out with any audio issues. Also, during the time that I will be handing over the presentation to Jamie and Anne, you can chat me as well, and we can help you resolve any of those issues. But you should be able to see the slides and hear the audio now and throughout the next about hour and a half. We are recording this session, and the slides also will be available afterwards for people to review or share with colleagues. And so we'll be posting this on our Community Action Academy or Moodle site within each of the 3 open learning community groups. And so that's the best way to access it. If you have any questions after the webinar about how to access the recording or the meeting slides, feel free to contact me via email. My email will be shared at the end, and it's also on the partnership website. All right. So let's go ahead and jump into our content for today. Just sharing a little bit of information about our learning community, which is kind of where this information is coming through to get to you. So the purpose of our learning community through the Community Action Partnership is really to analyze the community action outcomes and identify effective, promising, and innovative practices that alleviate the causes and conditions of poverty. So it's all rooted in what those causes and conditions are to be able to build capacity to address those. And so this topic today is very fitting because you have to know kind of what the data is telling you and what the landscape of the community is to be able to know how to address what those needs are that are present in the community. So this is kind of where it all begins as community action agencies and as you look at your community needs assessment and data. So of course our work is also grounded in the National Community Action Theory of Change. We like to just show this at the beginning of all of our learning community events just to kind of tie in all of the similarities of kind of the information that's being received. So you see, of course, our core principles. The second one here that I'd like to point out for this webinar is that we build local solutions specific to local needs. And so this is really central to the topic today as we look at what those local needs are and look at some different tools that can help to assess what those needs are. And of course, our goals that are centered around both individuals and families as well as the community. So our learning community actually has about 8 different learning community groups or topic groups. Our 4 open learning community groups are really kind of what's behind this webinar today and the topics that they have. And so we've started off with our health intersections, results at the community level, and cultivating data-centered organizations this month. We will be starting our decreasing family homelessness open learning community group in May. But obviously a lot of this information that you can gain from these different tools will be helpful in exploring that topic as well. So just some different framework components that we weave into our Learning Community Resource Center. Of course, we're very focused on ROMA, the NPIs and the annual reports, so those national performance indicators that agencies are reporting out on, as well as the data collection and data analysis that agencies are working through. And so all of these things that I've just mentioned are very important to what we're talking about today as far as collecting that data, assessing it, and analyzing it. We also like to weave in concepts around family-centered coaching, racial equity, trauma-informed care, to really kind of give that holistic picture and really understand what those needs are around the people that we serve. So we kind of operate with this definition of the learning communities, which is actually from the Harvard Center on the Developing Child. And you can read it here on your screen, but it's really about providing that space and structure for people to align around a shared goal. So we want to connect people, organizations, and systems that are eager to learn and work across boundaries while holding all members accountable across common agenda, metrics, and outcomes. And so this is kind of, although this definition came from a different place, this is something we've really adopted as we run the learning communities at the Community Action Partnership. So really our major goal here with these learning communities and sharing all this information with you is, that through small actions with a lot of people, we can achieve big change. And so that's what we're going for with the learning community, is to share this information and knowledge, allow you all to share information and knowledge with each other to result in that big change. So our learning community, just to give you a picture of what it's made up of, we have representation from all 11 regions within the Community Action Network, from 33 states and 407 counties throughout the nation. So we have, it's very culturally diverse. We have everyone from different field leaders, different levels of staff. We have rural agencies, we have urban agencies, and throughout all the agencies that are in the learning community, we're actually representing about, with all these agencies that we have, the number of people that are served through all those agencies totals over 1.6 million. So the impact of these learning communities can be very, very widespread across the people that we serve. And of course, this team that we have here, the Learning Community Resource Center team, is really what makes all of this possible as far as the logistics and information that's shared and things like that. We work with a variety of subject matter experts to try to deliver this content and pull together these groups. But the people that you see here on the screen are kind of the central Community Action Partnership team that works with the Learning Community Resource Center. So we have Jarl Crocker, he's our Director of Training and Technical Assistance. Tiffany Marley is our Project Director for the Learning Community. I'm Courtney Kohler, I'm a Senior Associate with the Training and Technical Assistance team. We have Hyacinth McKinley, who is the Program Associate for the Learning Communities, Liza Porras, who is also a Program Associate, and Charity Frankowski, who's our VISTA lead. And then we also have Jeannie Chaffin, who's recently joined us as a consultant working with the Whole Family Approach. And she is working on the Whole Family Economic Mobility Initiative. So these people are really central to all of this work that we do. So as we begin with this topic, we really want to talk about why do we need to gather community data. So why is this important that we're sharing this knowledge with you and that we've chose this topic? So we want to, of course, know what are those community needs, what are those family and individual needs. And to be able to identify those needs, we have to be able to look at the data. So another piece of gathering community data is providing a really concrete approach for assessing, planning, and implementing to appropriately address the needs that are found. So this is really just looking at the ROMA process. So we're looking at the ROMA cycle to identify what are those needs and what about those needs. Not just looking at the surface level needs, but what are those causes behind the needs that we really need to address through those strategies we have. And also the importance of collecting data and analyzing it. So figuring out what it means and turning data into information and knowledge for better decision making. And so it really all kind of leads up to innovation. So whenever you're looking at data and you're able to look at what are the needs, what are the causes behind it, you can innovate and create better strategies to be able to serve individual families and communities. And so that's really just the motivation behind this topic and behind looking at, the importance of data and analyzing it as well. And so these tools that we're going to share today, of course, help you collect the data, but then also can help you bridge into the analysis piece as well. And so we're excited to have a couple different subject matter experts. We have Ann Rubal, so she is from the County Health Rankings and Roadmaps tool, which is through the University of Wisconsin Population Health Institute. She is a population health analyst. So she's going to be sharing with us the County Health Rankings and Roadmaps tool. Then we also have Jamie. She is our project director through Community Commons. And so we actually have a Community Action Partnership Hub that is available to the entire network. It has several different indicators in it across all domains that align with the CSBG domains. And so this has been available to Community Action for a while as a free tool, and she'll give a lot more information about it. But she is through the Institute for People, Place, and Possibility, also known as IP3. So at this time, I'll go ahead and send it over to Ann, and she'll get us started in talking about the County Health Rankings and Roadmaps.
Okay. Can you hear me?
Yes, I can.
Okay, thank you. Sorry, I just want to make sure. Technology.
Sure, no, you're good.
Yeah, thank you so much for inviting us to talk about County Health Rankings and Roadmaps today. We are a resource at the county level, and our primary role is to aggregate data from national data sources that are either complex or hard to use, and so we try to aggregate that in a way that's meaningful for communities and community members to use that data to think about evidence and provide them evidence and guidance to help improve healthy communities. So I have to tell you that we're a collaboration, as Courtney said, between the University of Wisconsin Population Health Institute, but we're funded primarily by the Robert Wood Johnson Foundation. And we work all across the country. We're primarily based out of the University of Wisconsin, but we have staff members all across the U.S. Who are willing and able to help anyone who has questions or to help them as you have data concerns as well. So just 3 simple learning outcomes for today, just to let you guys know what we do and why we do it. And spoiler is that we do it to help improve health, and what we do is collect data and then help use that data to actually implement programs and policies to improve health. I'll tell you a little bit about the different facets of the County Health Rankings and Roadmaps program, and then we'll go live to the website and explore a snapshot and give you some tools to support your work so that you kind of know some of the tools that are hidden on our website that could be useful as you're starting to think about community health improvement, either measuring it or identifying needs. So how do we support communities? We do this through data, evidence, and guidance. as well as stories. So although I'll be talking mostly about the data today, I do want to acknowledge that part of our team works on evidence building, and this is through the What Works for Health website. This is a really good resource on our website where you can go, and they've looked at communities all across the country who have done health interventions ranging from things like tobacco cessation programs to high school graduation rate improvements, and they've looked at what programs and policies actually worked for those communities and why they might have worked or why they didn't. So it's a good starting point when you're thinking about where you want to focus. And then we also have guidance. So we have a team of community coaches, our community transformation team, who actually will work one-on-one with the community as needed, depending on where they are in either assessing their needs, moving along the action cycle to improve health, or bringing different people to the table. So there's a lot of resources outside of the data that I just want to highlight that I'm going to gloss over, but they're really important parts of our program. So just to root you guys in our model, why we do what we do. So we believe that programs and policies can influence health factors, which can influence health outcomes. And our ultimate data is a rank on health outcomes as well as a rank on health factors. And we talk about health outcomes about where your health is today in your community. So those are measures of length and quality of life. Whereas health factors are where your health could be in the future. And you can see that we divide this into 4 health factor areas: health behaviors, clinical care, social and economic factors, and the physical environment. And within those, there's different specific health factor areas as well. You know, tobacco use, access to care, employment, family and social support, housing and transit as examples. And all our measures fit into these categories. But our primary role is to think about that health is more than just health care. We include clinical care in the measure, but we know that to improve health in a community, you can't just work on one of these factors. You really need to integrate across the factors and start improving health holistically rather than just focusing on one area. Although focusing on one area is important to start, thinking about really longitudinal health improvement requires work in all areas. So we use data to reveal factors that influence health. And like I said, this data is the foundation of our program. We're going to release new data this year, March 14th, so in 2 weeks. So there's some data and tools that I can't talk about today, but if you check back on our website, which is on the slide, countyhealthrankings.org, we will have some new tools as well as new data for all our measures there. But we've been doing this for 9 years, or this will be our 9th release. And that's where we started, and then we've transitioned into now helping communities use that data to improve health, not just providing the data. So this is what our website looks like, countyhealthrankings.org, and I encourage you guys to play around on it. There's a lot of data and resources that I'm not going to get to touch on today that are on the website, but I'm happy to answer other questions on there. And I'm going to show you some of the tools, and I've included it in the slide deck because Courtney said she's going to share the slides with you guys. So I'm going to go through them quickly, or so that when you go back, you have a list of what we kind of looked at. I'm going to share my screen and take you live to the website. Okay, so here we go. So this is the website, countyhealthrankings.org, and when you get here, you can either insert or type in your county name, or you can click on a place. So I'm in Wisconsin today, and it's chilly, so we'll go to Arizona and look at Pima County here. So this brings up the snapshot, and the snapshot is the bread and butter of what we do at County Health Rankings. So you can see we have health measures, which again fall into those categories that I mentioned before: length of life, quality of life, health behaviors, etc. And on the snapshot, we have data for each county, a trend graph if it's available, and then an error margin, as well as top U.S. performers, so that's the top 10 percentile for the nation, so it gives you a comparison tool about where your county is falling, as well as the value for your state. which can be useful. And then the final column is the rank. And when we talk about ranks, we talk about ranks as a way to gather attention, but what we're really trying to do is drive people to the data themselves in order to identify the needs in their community. So you can see here for premature death, we measure YPLL. If you hover over it or click on it, it'll give you the definition. And again, you can compare that value, 7,100 years of potential life lost. It's higher than those top U.S. performers and even higher than the state value, but it is improving. And you can click on these trend graphs, which I'm hoping shows up, and it shows that the trend is decreasing and how it compares to the U.S. and Arizona as a whole. So you can see it's not to the level of the U.S., which is what we were seeing with the comparisons. But it gives you a place to start and think about how your trend is changing over time or how your trend is faring in comparison to those other places. A couple other tools I want to mention is we don't just have the snapshot here. We also have additional measures. And additional measures are any place there's these gray bars with a plus sign, and you can open them up. So these are just unranked measures that are included, and they're unranked for many reasons. Sometimes they're just demographics. Sometimes we have a similar measure that we rank on, and sometimes we just don't know how they impact health. For example, a good example of that is healthcare costs, which we know healthcare costs are important to health, but we're not sure that more or less expensive healthcare is associated with better or worse health outcomes, for example. So if there's a measure that you're interested in that doesn't appear in the snapshot, it could be hiding in one of those additional measure tabs. Another feature that is useful for communities is, let me scroll down. So we're going to actually be adding a lot more of these on the 14th, as I mentioned, but a good one to look at is children in poverty. So if you click on children in poverty, if you click on any of our measures, actually, it'll bring up the map for the state that you're in, and you can click on the data tab, and it'll bring up all the counties in your community or in your state on that measure. Again, the trend graphs, the error margin, the z-scores that we use to rank, but then it also brings up measures by race. And this can be really helpful when you're trying to figure out what type of intervention to do or who is actually affected by the measure that you're talking about. For instance, here you can see in Coconino County, children in poverty for the county is 21%, but among blacks and whites it's 12 and 10%, but among Hispanics it's 40%. So it gives you an idea of what populations you might want to start working on. And then one of our other tools that we have here is this Learn More About This Measure feature, so you can click on that. And we talk about in community terms, so non-scientific academic terms, what is the measure and what does it mean? Why is it important to health? Can you use it to track progress? But one of our favorite resources that we added last year is what other resources are available for this measure. And for instance, for children in poverty, you can dig deeper on this measure by going to the Small Area Income and Poverty Estimates website or Community Commons. And I won't touch on Community Commons since the other co-host or co-panelist is going to touch more on that. But that's a great resource, and we like to drive people to that who want to dig down deeper than the county level. So I'm going to go back to the snapshot and show you a few other features. So one thing we do to identify needs or to help communities identify needs is you can check these boxes that are areas to explore and areas of strength. And they will highlight in yellow and purple, or sorry, orange and purple below. And this is just to give you an idea of where you might want to start. So we do some scientific and statistical analyses to do this, to highlight these and pick these, but you can tell by looking at them why they might be highlighted. So teen birth, for instance, is much higher than, or sorry, is better than the state value, but is still worse than the 10% value. But that's they're faring pretty well on that. In comparison, you can see sexually transmitted infections is much higher than the state value and that national benchmark, and it's trending poorer. So the graph is red, and you can see that county line is increasing higher than the rate of the state and the nation. So these are just tools that we have to help you start thinking about what improvement you might want to do in your community or where you might want to focus. Again, it's just a starting point. We don't know what is going on in your community or what your community is interested in, but they're just tools designed to help you start thinking about that. One of the other cool features that we have is this Compare Counties feature. And this is nice because you can compare across states. So if you're in an area that, in a regional area that crosses state lines, or if you know of a county that's similar demographically to you, that you think you should perform the same way in health, on health outcomes, you can compare them. You can select up to about 10. We haven't maxed it out yet, but it's nice because you can compare side by side those data points right next to each other, which is really useful in terms of thinking about where you might fare the same as another county or where they might fare worse or better than you in terms of thinking about what are they doing to improve that specific health measure. And then I also want to just highlight that we have this Downloads tab here, which has state reports as well as the actual raw data itself. So if you don't want to print it out in the snapshot form, you can print it out as an Excel spreadsheet, as well as you can get the national data if you use our search bar and if you want all the counties. And then we have state summary reports, which are helpful because the very last page has all the data sources and measures that we use, data sources, measures, and years of data that we use for every release. Two other resources that I wanted to point out to you are our Finding More Data tab, where we provide state-specific resources. So you can click on your specific state. I'll click on Wisconsin just to show you an example. And it has data resources that exist in Wisconsin. These are just resources that exist at the state, and we can't, unfortunately, use them nationwide because we need county-level data for every county in the U.S. But we also list these national resources down here, some really good ones. So we've picked the 3 that we most likely refer people to, which, as I said, Community Commons we're going to talk about in a bit, but that's one of our favorites as well. And then we have the 500 City Project. If you're lucky enough to live in a city that's in that project, you can get data at a census tract and neighborhood level, which can be really useful. And then finally, I just want to touch on the some rankings reports that we have as well. So every year we put out a national findings report, and this compares things like urban and rural on different measures, or things, for instance, last year we focused on injury deaths and opioid deaths, but we couldn't get the data specifically at the county level, but it helps you put your county or your community's work in a national framework, so that can be a useful tool to look at as well. And then from any of the measures, so let me just go back to the snapshot. So there's plenty of ways to get around on our website, so sorry, I know I'm going quickly, but if you want measures, let's say we wanted to work on adult smoking, we can scroll down in the data tab here and see and sort any of those measures, again, to look at community by community. And then you can click on this policy tab, which will take you to what I was explaining before, the What Works for Health tool, which has programs and policies that other people have tried and either published in peer-reviewed journals or different kind of reports that a team here has collected and thought about kind of ranking them in terms of scientifically supported or not scientifically supported, as well as what impact those interventions can have on disparities. So it's a good resource. If you know where to start, you don't always have to go and do the lit review yourself. We can help with that. So I think with that, I will pause and I will stop sharing my screen and see if any questions came in during that time.
And we did have one that asked if, can this tool aggregate data from multiple counties? I know you showed the comparison tool, but wanted to see about the aggregation. Aggregation.
So in general, yes. I would always, so if you click on the Get Help button that's on any page of our website, we are happy to, we reply within 24 hours. So most of the measures, yes, that's fine. You can aggregate completely with no problem because of most of the measures. But there are a couple where I would be weary of just saying you could do that straight out. I would give you some limitations. So that's my only caveat with that. But you can, compare them, and then you can also aggregate them because most of the measures we provide in the snapshot or in that data table, we provide the numerator and denominator for calculating the percentages or the rates. So that would be completely fine.
Okay. I believe that's the only one we saw come in at this point.
Okay. Well, then I will pass it over to Jamie. And if other questions come in, I'm happy to answer them at the end of the call.
All right. Great. Thank you, Anne. We appreciate it.
Thank you.
Great, thank you. Well, this is Jamie Kleinsorge. I am a project director here at the Institute for People, Place, and Possibility, also known as IP3. We're one of 3 organizations that helps power community commons, and so that's where we're going to be spending some of the rest of our time today is on the community commons site. So if you're interested in following along at your computer or in the future, you'll want to go to communitycommons.org in order to do that. And just a quick note that if you are not currently registered as a member on our site, you'll want to do that to make sure that you're able to access all of the tools and resources that I'm going to show you today. Up here in the right-hand corner, you're able to see there's a register button. I'm logged in right now, but typically there's a register button, and all you need is an email and a password and a username to get registered on the site. So a couple of things that I want to highlight today really are the Community Commons map room and just introduce you to the data that we have available on our site. And then also, we're going to explore the Community Needs Assessment tool very briefly. So we have worked with Community Action Partnership at the national level for the past couple of years to provide a comprehensive Community Needs Assessment tool to help you all do your Community Needs Assessment work on a triannual basis. And so, we'll be exploring that and looking through some of the indicators and data visualizations that are available to you. So the first place that I just want to start really quickly is our home page, though. I would definitely encourage any of you who don't visit Community Commons regularly, or if you are looking for inspiration or to see what other folks are doing around the country, we like to highlight stories of what other communities are doing and how they're using data to support change in their community, how they're using community health needs assessments and community needs assessment tools to really drive that change and set priorities and make impact. So this is a good place, I think, to come and just get inspiration. And you can search our homepage, or we also have channels available to you, and you can search the different channels based on topic. Where we're going to be spending some of our time today is under this Maps and Data tab. So we really have 2 sides of the house here. We have our map room, and then we have our reporting side. So over here on the reporting side, just to note, this is a community health needs assessment, which is akin to the community needs assessment. It just is more focused on health. And I'll show you how to get to that community needs assessment here in a minute. We're going to start here, though, over on the left-hand side under Make a Map. Simply by clicking that Make a Map button, it gets you into the Community Commons data warehouse. And I wanted to spend some time here just so you all are aware of the types and the depth and breadth of data that's available to you on Community Commons. So there's a couple of different ways of searching data on Community Commons. The first and easiest way is probably just by searching a keyword. So you can see here I can type in a word like poverty, and I'm able then to see all of the data layers that are available to you to view around poverty. You can see here that I have about 277 layers to choose from, which can feel a little bit overwhelming, but a few things to keep in mind. So these are from different years. So if you are looking for the most recent data that we have available, you can use this filter over here on the left side where it says sort by release date. And it's going to go ahead and it's going to pull that data that's most recent to the very top so you can filter through it that way. As you can see here, one of the most recent data that we have available around poverty is from the county health rankings. So I did want to note that all the data that Ann just showed you in map is available on our site in map form. So if you were interested in taking some of the county health ranking data and exploring it with other indicators that we have available, you can do that here in this map room. To find the county health ranking data on Community Commons, you can simply type CHR in the search data box, and it'll bring up all the different county health ranking indicators that we have available to map. But here now you can see that we have all of the most recent data related to poverty aggregated here, and we can click any of these in order to add them to the map. The other thing to note here is that they are from different sources. So that can often be important if you're looking for data with a specific methodology or from a specific source. And you can get more information about the source by clicking the info button next to any of these individual data sets. So what you'll see here is a description. It tells you a little bit about what the data is telling you. It gives you a release date and how often it's released. It tells you what geographic unit it's available at. So for example, this is only available at county level, but I do know that we have some American Community Survey data that's available at lower geographies like census tract and zip code. And then we also have links back to the original source. So if you did want more information about where the data came from, you're able to get to that very quickly. So I'll show you, for example, an ACS data set here. And you can see that that geographic unit now says state, county, place, tract, zip code, and this is a public use micro area here that's a census designation. So this is available at multiple geographies. So that may be another way that you want to filter. And you can do that also over here on the left-hand side. Right underneath that sort by release date, you can sort by geography. So if you are looking for indicators that are available at a county, sub-county, zip code level, you can sort the data by that designation. Some of the other things to keep in mind, for example, with poverty is that it's available at many different levels. And I know that that's an important indicator for you all at Community Action, specifically because I think many of your funding sources probably say, well, we want to serve folks that are at 185% of poverty or at 100 or 200. And so we do have those designations available here. And then we also, as you can see, have it broken out by age. So if you're interested in populations, for example, that are over the age of 65, you can easily add that to the map, or you could look at just those populations age 0 to 5. So just by clicking Add to Map, I was just going to demonstrate very quickly how all of these data layers will then populate on the map and you're able to interact with them. You can zoom in and zoom out by using the buttons over here on the left-hand side to do that, or you can also enter a location. So for example, if I wanted to look at Chapel Hill, North Carolina, I could simply type that in here, and it's going to take me to Chapel Hill so I can see that area a little bit more closely. It looks like some of the data layers that I'm looking at are, they are by zip code, so it's asking me to zoom in even more so I can see that information at a lower geography. So you're able to add multiple layers to the map. Again, if you are looking to marry some of that county health rankings data with some other data that we have available, you can do that very easily here in the map room. If you wanted to add additional data, you can click this Add Data button. So I'm going to go back to the screen, though, so you can see two other ways to search. We do have a taxonomy that we use on the site, so if you are interested in, for example, looking for other types of income-related data, you can search under this economic category. If you're interested in environment data or health data, you can do that just by clicking on these little blue arrows. You can see all of the data layers that will populate underneath those specific categories. And again, you can just click the checkbox next to each of them to add them to the map. I'm going to go ahead and start over. The last way to search is browse data by source. And so here you can see this is a great way to know just the breadth and depth of data that is available on Community Commons. You can see all of the different data sources that are available to you and the indicators that are available to add to the map. So you can see here we have a pretty wide variety of information. We have information about crime, IRS status, nonprofit organizations, and the list just continues. I can't get through all of it, but I encourage you, if you haven't explored this list before, to definitely do that and see. You may stumble on some data, as I sometimes do, that I didn't even know we had in here. And so it's sometimes fun to just explore to see what's available. Once you've created a map, you can save, share, or export it. You can save it to your profile on Community Commons. You can share it easily on social media sites, or you can get a map link to share with others, or you can export it either as an image file or as a PDF document. And this is really nice, especially if you're going to be doing a presentation in your community and you want a map to drop into a PowerPoint, or if you're writing a report of some kind and you want a map to include in your report. This is a great place to start for that. We do have some advanced data tools, so if you're looking to query or measure anything, we do have some of those data tools available here. Unfortunately, we don't have time to get into that today, but we do have some support items, some support videos that you can watch if you are interested in learning more about those advanced mapping tools. So the next thing that I want to show is the Comprehensive Community Needs Assessment Report that's available on the Community Action Partnership Hub. So we just spent some time under this Maps and Data tab, and now I'm going to click this Hubs tab. And what you're going to be looking for here is this Community Action Partnership Hub. And so you can join the hub. I'm already a member, so this says Leave Hub, but you can join the hub. It's public, so you can join without any sort of approval. And once you click into the hub, it's going to take you right to the Community Action Partnership Hub homepage. And you can get a quick tutorial on how to use the CNA report tool. You can instantly start a new assessment, or you can learn more about the data. So if you are interested in knowing what data are included in the Comprehensive Community Needs Assessment Report, this is a list of it here. So you can see all of the different data categories, the indicator name. You can get direct links back to the original source. It does tell you the source geography here, whether it has a benchmark, and whether it has breakouts by groupings. And when we say groupings, it's akin to what you saw on the county health ranking sites, looking at age, race, ethnicity, gender, some of those groupings. You can export this list to Excel, or you can also search it if you're looking for something specific. So I'm going to go ahead and go back, though, and I'm just going to go right in to start a new assessment. So the first thing that you're going to want to do is choose your state and then a county or a series of counties. So I'm going to go ahead and just select Arizona, and I'm going to select 2 counties in Arizona. So I could select just 1, or I could select 5, and it really depends on what you want your report area to be. So for example, if your community action agency serves 3 counties, you'll want to select those 3 counties. Or if maybe you're doing some targeted work in 1 county, maybe you'll only want to select that 1 county. So once I've made my report area selection, I'm simply just going to click this View Report button. And what's going to happen now is that the Community Commons system is going to pull data. There's about 120 indicators in the community needs assessment report and for the specific area that you've selected. So you can see here at the top of the screen we have this report area. Then we also have these data categories. So the data categories we like to think about as like chapters in a book. So population profile, employment, education, housing, income, nutrition, and health. And so those are the major themes of the report. And then under each data category we have our pages or our data indicators. So you can see things like poverty, households in poverty, child poverty rate, seniors in poverty. And so those are the individual indicators that you can explore. Each indicator has a page, and so this is what the page looks like. For example, for population change here, we have the name of the indicator, and then we have a nice STEM sentence that gives us a quick snapshot of the area that we're looking at. Then we have a data table, and what's nice about this data table is that automatically this report area is an aggregate of the 2 counties that we've selected for our report area. So we can see that this is an aggregate number of those 2 counties, and then we can also see the information broken out by county individually. So for example, if you wanted to do some targeted intervention here, it looks like the first county here is doing much worse in terms of population change than the Gila County, and so you'd probably want to focus your time and energy on in Coconino instead of Gila. We have a nice the data tables are downloadable, and if you have any question, again, about where the data came from, the source information is underneath each table. It is benchmarked then to the rest of the state that those counties reside in, so here we have Arizona, and then also benchmarked to the rest of the United States. And that's easily viewable then in this dial here on the right-hand side. So you can see that this report area, again, is the aggregate of these 2 counties, benchmarked to the rest of Arizona and the full United States. You can see this also in a nice interactive bar chart. And then we also like to represent it in a map. So one thing to keep in mind with the map is that if it is available at a lower geography, so here we're reporting data at a county level, but the map is showing tracks. So we do report it at the lowest available geography that we can within the map. So you can open this by clicking this View Larger Map button, and then you're able to toggle if you wanted to see it as a county level. You can do that here in the legend. You could see this data at a county level if that's what you were interested in, or you could toggle back to the track level. So going back to the report here, I'm just going to go ahead and pick another indicator to explore. So you can see here again, I'm looking at poverty. We can see a quick estimate of persons living in poverty for these 2 counties that we're looking at. Again, we can see a poverty number for the report area aggregate, and then each of the counties broken out. We also have the dial here on the right-hand side. And then as we scroll down, I guess this one doesn't have the breakouts that I was looking for. We'll look at another indicator here. So this is current unemployment. So again, you're going to see some of those similar components, our STEM sentence here, our data table, a nice dial. And let's see, we have also an unemployment change. So let's see. We have rate of change, so it looks like this area is doing pretty well. We have indicators around educational attainment. So here you can see again that if, for example, you wanted to target some interventions around education, it looks like there's one county that's doing a bit worse, so you'd probably want to spend some of your time there. And then we have it broken out again. Anytime we can break out the data and give you more information, we can see here that it's broken out by high school diploma, some college, associate's degree, bachelor's degree. So that's just a quick overview of what's available within this report. There's a lot of information in here. As I mentioned, there's about 120 different indicators that are available to you here that you can scroll through. And so we encourage you to take some time to look through all of the data that's available. If there's anything, here we go, this is one of the indicators I was looking for. If we're ever able to report change over time, we absolutely like to do that. And so you can see here that this looks like there's been some work done, hopefully, and some children have come out of poverty and are no longer eligible for free and reduced price lunch here. Looks like that has trended downward for these two areas. So a couple of other items, you can save and download this report. You can save it as a PDF, or you can also save it as a Word document, which is my preferred choice, because then you're able to do some modifications. So if you wanted to include additional data, you wanted to include some community stories that relate to the information, you wanted to add some pictures or additional data visualizations, you can do that very easy within that Word environment, or you can take the items from the Word environment and put them into a PowerPoint or something very easily. And just so you know, all of these components come with the report. So in that Word report, you would get all of the STEM sentences, the data tables, the dials, the inset maps, those types of things will all come with you. So that's just a quick overview then of this report. If you are ever looking for additional indicators in the reporting environment that you can't find here, I always recommend folks come back to our Maps and Data tab and explore our Community Health Needs Assessment report. It does have some different indicators than what are available within the Community Needs Assessment report. And so there might be something in here. Again, you can see some of these indicators or the additional indicators that are available within this Community Health Needs Assessment report that you could then also easily pull into a Community Needs Assessment report if you were interested. The last thing that I want to hit on is just our support page. So again, if you have any questions or you're exploring the site and you have questions about how to use something, we encourage you to use our guidebooks. We have some short videos and some FAQs. These videos all range from 1 to 3 minutes in length, so they're real quick and get to the point. And so if you also continue to have trouble, you can always contact us. We have a support ticket system, and most likely you'll hear back from me. We have a small team here, but I'm always happy to help the community action folks if they have specific questions about the needs assessment report or anything else on the site. So with that, I'm going to go ahead and pause for questions and see if there are any.
Great, thank you, Jamie. So we did have, you kind of just answered one of the questions that came through about if there are any questions about Community Commons functionality or the data. They were asking if they can contact you directly or if there's another contact. It sounds like you just go through that contact piece down at the bottom of the page.
Yeah, you can click the contact. There's in the footer, it says contact, or on the help page, there's this still contact us here link. Or yeah, you can reach out to me directly. I don't know if you have my email on any of these slides, but I'm happy to answer any questions directly if folks have questions.
Okay, great. And I can add it to the slides before I post it if that's okay.
Yeah.
And then this is more for us or just as in general. When will this video recording be available? If we want to review the material again, just to answer that for everyone on the line, what we'll do is usually within a couple of business days, so either by Friday or Monday of next week, we'll have this publicly available, and we will add it to our Community Action Academy site. And it'll also be available through some of our other resource center and blog sites as well. But usually by Monday, if you don't see it, feel free to email me and we'll make sure you get connected to it. But we will be adding it specifically in the Community Action Academy site within the 3 open learning community group courses, the health intersections, cultivating data-centered organizations, as well as the results at the community level. And then Jamie, we did have another question come through about Community Commons and whether Community Commons captures crime data.
So we do have some crime data from the FBI. They have crime statistics that they report to us, and so I do believe that we have crime data associated with like violent crime, homicides, some of the others. Some of it is available at like a jurisdiction level, and then some of it is available at a higher population, like a county level or per 100,000 or per 100,000 persons. Unfortunately, we don't pull in any crime data like from any local sources or anything. It's just from that FBI level.
Okay. And then we did have another question just about the, I believe it's regarding the collection of the data. So can you talk maybe just a little bit about the process of kind of how you get all the data and put it all into Community Commons?
Yeah, sure. So I may not be the best person to answer that, but so we have, as you saw, data from many different sources, and those sources release data on varying schedules. And so throughout the year, you know, we have alerts to when we know new data is going to be available from different sources. And so it's a constant cycle of data updates. And because of that, you know, we're always updating our reports, and that's the other great thing I think about the CHNA and the CNA available on the site is that they are dynamic reports. And so if you were to save a report on a Monday to your profile and you came back on Friday and, for example, some unemployment data had been updated in the meantime, that report's going to reflect the most updated data that we have available. And so, yeah, it's kind of a rolling updated cycle. We are working feverishly right now to get all of the ACS updates out to all of our partners. That's the largest data set that's released every year, and so it just takes us some time to process all of it. And so we're expecting that to be released very soon. And so that will update in the CNA and the CHNA on the site. So yeah, I mean, that's basically it. We're kind of at the will of the original data sources themselves. So if they're late on a release or, you know, or they don't make their raw data files available right away, we kind of have to wait on them to do that and then integrate it into our system.
All right, thank you. Okay, it looks like at this time I don't see any other questions that have come through. I was doing a double check, but what I'll do is if anyone on the line does have additional questions, we do have a few more kind of closing slides to go through. And I believe Anne kind of mentioned this during her presentation, but there is, it looks like both sites, Community Commons as well as County Health Rankings, has you know, kind of releases and updates coming out, so make sure you're looking out for those. All of these kind of links will be embedded in the PowerPoint presentation. We'll share it as a PDF through that Community Action Academy site so that you can access these. I'll also add in the panelist contact information just in case you have any troubleshooting questions or data questions for the site. So we heard from both of our panelists today, and thank you both so much. We also went through some questions, and of course, as you have questions that might kind of roll in your head in the next few minutes, please send those in, and I'll check back at the very end. But we have a number of different resources to share. Of course, you heard some of our resources through the Community Commons site with the Community Needs Assessment Tool. County Health Rankings and Roadmaps is another one that we like to promote. And through those tools, you definitely have a wealth of resources around data, the mapping, which can help you with analysis. Another, you know, like Jamie was saying, there's some of those kind of preset tools in there, such as like the location opportunity tool and things like that, vulnerable populations. And so some of that stuff can really help you get started in kind of layering your data and looking at how the different indicators overlap. We also, I think it's really great that the County Health Rankings and Roadmaps has the evidence-based practices that are kind of already lined out for you. And so I know in community action, we're often looking for those evidence-based programs to see kind of what works and what has been vetted in the field. And so that's a really great resource, as you're identifying what the needs are and determining, what should we do about this. That's a really great place to look for some different ideas around programs that have been successful or that have, are kind of scientifically, vetted. So as far as some of our learning community resources that we do have a learning community blog, and it's lcrcweb.com. You can follow our blog to receive regular updates, but we often post a variety of resources across all of our learning community groups, as well as a rolling blog that we're kind of kicking it off for this next third phase of the learning community this year. So make sure you check that out and follow to receive the regular updates. We also have our CSBG TNTA Resource Center, which has a variety, hundreds of resources within it, including webinars, publications, toolkits, etc. There's also a consultant bank in there if you're looking for a screened list of consultants. And so definitely check that out and utilize that resource center. Then, of course, our webinar Wednesdays, which you're engaging in right now, but on our webinars page of our website, it gives a full listing of the webinars we have coming up on Wednesdays as well as other days of the week. So I encourage you to check out that listing and register for what you're interested in, as well as for what aligns with the learning community groups. We'll be sending out some announcements soon for the open learning community groups and the upcoming webinars throughout the spring and summer. So I've mentioned this Community Action Academy a few times, but this is a really great way to stay connected and continue learning through our open learning community groups. So this is a free online learning hub for the Community Action Network. You can go to moodle.communityactionpartnership.com and create a free account. Once your account has been confirmed through your email, you'll receive an email. You just have to click a confirmation link. Then you can log in, and then under the course categories, or if you just simply scroll down and click the learning community category, then you'll be able to see the open learning community groups. And so those are open to the entire network. And as you access these open learning community group webinars, feel free to engage in those online learning spaces and join us for future webinars. So some of the upcoming webinars that we have related to these learning communities that are participating today. So we have our, as a part of the results at the community level on March 21st, we'll be talking about strategizing and measuring community change. We already talked a little bit about identifying the need in our last webinar earlier this month when we talked about thinking about community level work. We also talked about different tools today that you can look at to see what data is available around the community needs that are present to help you identify that. So in the meantime, if you're a part of that learning community group, we encourage you to check out these tools that have been presented today and look at what are those top needs in your community. Also look at your community needs assessment in your agency and just kind of get a short list of what are those top needs that your agency is working to address. And then come on March 21st, and we're going to be talking about strategizing around addressing those community needs and individual and family level needs as well, and measuring that community change that you want to see. Then on March 28th, as part of our Cultivating Data-Centered Organizations, we're going to be talking about taking data out of silos. And so as you looked at community level data today, the Cultivating Data-Centered Organizations, of course, as you're centering your organization around data, you're looking externally at community data as well as internally at your program data. And so we're going to be talking about taking that data out of silos on March 28th. Then on April 4th, we're going to be in our Health Intersections Learning Community Group talking about case management and referrals to address the social determinants of health. So as you saw through Community Commons, for example, as well as county health rankings, the different categories and domains and indicators really align with the different social determinants of health. And so we talked in our first webinar for Health Intersections about, looking at what is the screening process? What does that assessment look like for families around those social determinants of health? What are different questions that you can ask? And so that's really looking at the individual and family level inside your agency. Today we kind of focus a little bit more on what are those, what is the data around the social determinants of health throughout the community. And so whenever we come together on April 4th, the Health Intersections Learning Community is going to be talking about, looking at case management and the referral process to address the social determinants of health that are present. So now that we know what these different needs are around these different determinants, what do we do about it? And so that comes with us on April 4th, and we'll be discussing that. And then just a foreshadowing into the spring, as part of our Health Intersections group as well, we're going to be talking about health equity. So we're going to be having a two-part series on April 25th and May 23rd. And so we encourage you to register for those as you're interested. I did see a question come in about how do you register for these webinars. They are available for registration on the webinars page of our website. And so what you do is go to communityactionpartnership.com, and then if you go over to the Events tab, drop down and click on Webinars, then there'll be a full listing of our learning community webinars such as these, as well as the webinars across our other different topics that we focus on as the Community Action Partnership. All right, and then as all of you that are part of the core learning community groups, of course I know we have some network-wide members on the webinar as well. If you're a part of the core open learning community groups that we talked about today, there is a baseline survey that helps us gauge learning and make improvements within our open groups. So please make sure you take this if you're joining us for the whole cohort of the learning community to let us know kind of where you're at now and help us measure learning over time. So I'll go through and see if there are any final questions. I don't see any here, but I do have contact information up for our LCRC staff team on the screen now. So feel free to reach out to any of us with your questions. Again, I'm Courtney Kohler, the Senior Associate with Training and Technical Assistance. So my email address is there, ckohler@communityactionpartnership.com. And feel free to ask me any questions regarding this webinar, and I'll be happy to answer those. I can also connect you with the panelists if you're having trouble finding their contact information. So with that, thank you so much, Anne and Jamie. We appreciate you joining us today and sharing your tools and resources. And we hope that everyone will go check those out and register for accounts and download some reports and use the tools. So thank you all, and thank you all for joining us today. We appreciate it. We'll be sharing out this information for future reference in the next few days.